Hello everyone. We welcome you to this discussion session about lifestyle medicine. Below are the learning objectives for the session. Chronic disease is known internationally as NCD, non-communicable disease. Worldwide, chronic disease accounts for 60% of all death, 35 million worldwide, double of all infectious disease, maternal child death, and nutrition deficiency combined, according to World Health Organization. If risk factors were eliminated, 80% of heart disease, stroke, and type 2 diabetes can be prevented. 40% of cancer can be prevented. The immense burden of heart disease is causing disaster. Every 34 seconds, one American has a coronary event, and approximate every 1 minute 23 seconds, an American will die, and 1/6 deaths is related to heart disease. 379,559 Americans, 620,200 will have a heart attack, 295,000 will have a recurrent heart attack, 150,000 will have a silent heart attack. CVD is the #1. Cause of death globally, 31% of all global death. American College of Cardiology guidelines. Even invasive therapy is not significantly effective. Courage or beta ischemia prove that you can stent arteries, but you can't stent an unhealthy lifestyle. Findings from the Orbita study presented at TCT 2017 and published in The Lancet suggest that in patients with medically treated angina and anatomically and hemodynamically severe coronary stenosis, percutaneous coronary intervention, PCI, may not increase exercise time compared to placebo. This is the first placebo-controlled randomized trial of PCL in this patient population. Orbita randomized 200 patients with severe, 270%, single vessel stenosis to either PCL 1105 or placebo 95, using a blinded sham procedure where neither patients nor their physicians knew which group they were assigned. All patients underwent cardiopulmonary exercise testing, symptom questionnaires, and dobutamine stress echocardiography before and 6 weeks after the procedure. The primary endpoint was difference in exercise time increment between arms. Overall findings showed no significant difference in the primary endpoint of exercise time increment between arms. However, PCL did significantly reduce ischemia as assessed by FFR and stress echo. It may be shocking to know that 700,000 new cases of cancer will be diagnosed in the United States and 640 will die from the disease. According to the AKR, estimated we can prevent 50% from happening. Every day we have cancer cells developing. Our body seeks, destroys. We can see the estimated percentage of cancer deaths attributable to established risk factors, including tobacco, diet factors, and many others. Lifestyle medicine as a specialty is emerging as a specialty, having a negative cost for interventions, which are not only low cost, but also high impact. Epidemiology of diabetes. 1 in 3 in Americans has either diabetes or prediabetes. Not only it involves evidence-based approaches focusing on fundamentals of life, but also aims to prevent, treat, and also often to reverse the chronic lifestyle disease, including hypertension, diabetes type 2, obesity, osteoporosis, multiple cancer types, etc. Dean Ornish was the first to offer documented proof that heart disease could be reversed by lifestyle. Most patients' chest pain disappeared 82%. Artery clogging reversed. This was required reading during my medical school years almost 3 decades ago. What was the Ornish plan? It included intensive lifestyle changes, 10% low-fat whole foods vegetarian diet, aerobic exercise, stress management training, smoking cessation, group psychosocial support, for 5 years. 1 year initial study was extended to 5 years. The decrease in stenosis in experimental group, but increase in control group. Moreover, 2.5 times more events in the control group were noticed. Restoration of myocardial perfusion before and after treatment is seen. Positron emission tomography, performed on a patient with coronary artery disease, shows an area of myocardium with insufficient blood flow on top, following only 3 weeks of plant-based nutritional figure to reversal of coronary artery disease from publication in the Journal of Family Practice. July 2014. Vol 63. No 7 page 257 coronary angiography reveals a diseased distal left anterior descending artery, A. Following 32 months of a plant-based nutritional intervention without cholesterol lowering medication, the artery regained its normal configuration, B. Intervention, normal blood flow was restored. Bottom. Let's go through the important tools of lifestyle medicine. Medical tools. We know the various procedures from article in Trends in Endocrinology and Metabolism as Roux-en-Y gastric bypass esophagus pylorus. Tools of lifestyle medicine are multiple, which may include motivational interviewing or art of interviewing patient, determining where they are at on the change spectrum, and having them formulate a plan for themselves. In other words, getting them to do what they want, and having them believe it was their idea. Another one is group medical visit groups of 10 to 20 clients, with facilitator. Offering about 1.5 hour curriculum can be billed as office visits with preparation. Next one is intensive lifestyle treatment, ILT, meet with client 1 every 2 weeks to follow them through the process residential treatment, full immersion in lifestyle changes, which is intensive cardiac rehab, ICR, or Ornish program. Other professionals in lifestyle medicine team often include physicians, physician assistants, nurse practitioners, registered dietitians, personal trainers, physical therapists, occupational therapists, yoga, tai chi, mindfulness instructors, wellness coaches, nutritionists, culinary medicine, chef health, psychologists, mindfulness-based stress reduction. Treatment modalities of lifestyle medicine. Forks, plant-based nutrition. U.S. food consumption as percent of calories, PLANT, food and animal food. Cholesterol is found mostly in animals. Fiber is found only in plant foods. Moreover, animal foods are the primary source of saturated fat. Any diet that can be stored is always processed. For example, almonds in candy bars, apples in apple pies, or spinach in frozen spinach souffle. And of course, these would not be healthy choices. The much easier to understand than the USDA food pyramid, with no food focus, should be on whole unprocessed industry influence. Eat less from the animal and processed food groups and more whole foods in general. Food from the animal and processed food group contribute faux disease, which is opposite to the WHOLE foods from the plant food group. Processed food include added fats and oils, sugars, refined grains, which is worst. Dietary fiber intake. Average intake in the USA is 15 mg for women and 80 mg for men. Most don't meet adequate fiber intake. Found in plant foods only. Fiber improves blood glucose control. Fiber is linked to increased satiety and reduced incidence of diabetes. Where do you get your protein from? Animal proteins tend to elevate cholesterol, promote heart disease, increase osteoporosis, increase growth hormones, accelerate cancer cell growth. Associated with Alzheimer's, gout, kidney stones, gout, chronic kidney disease, autoimmune diseases, and many others. Interestingly, a plant-based diet with adequate variety of foods and enough calories will have enough protein. It's not protein alone we need to worry about, TA. but many other nutrients percent: vitamins, minerals, phytonutrients, antioxidants, etc. Nutrient composition: plant and animal-based foods per 500 calories of energy. I would like you to pause and check here. The difference here is too much, especially for vitamins, cholesterol, fat, and so many vital nutrients. Do you agree with me? Plant foods are the best fuel for the body due to multiple reasons: as nutrient-dense, anti-inflammatory, antioxidative, stress, increased energy, optimized athletic performance, reduction and treatment of cancer, prevention and reversal of heart disease. These foods do not have labels: more pharmacy and less pharmacy. Hopefully you may appreciate the difference. Power plate includes following: 1. A plant-based diet. Fruits, vegetables, whole grains, legumes. 2. Limit added fats, oil and animal products. 3. Eat lower glycemic beans, whole grains such as oats, potatoes, squash, berries, and lentils. 4. Aim for 40 g of fiber daily. Is eating plants only healthy? It is the position of the Academy of Nutrition and Dietetics that appropriately vegetarian, including vegan, diets are healthful, nutritionally adequate, and may provide health benefits in treatment of certain disease too. Diets are appropriate for all stages of the life cycle, including pregnancy, lactation, infancy, childhood, adolescence, older adulthood, and plant-based diets are more environmentally sustainable than diets rich in animal products because they use fewer natural resources and are associated with much less environmental risk. Vegetarians and vegans are at reduced risk of certain health conditions, including ischemic heart disease, type 2 diabetes, certain types of cancer, and obesity. Vegans need reliable sources of vitamin supplementation. Plant-based intervention for diabetes is supported by multiple evidence of low-fat and high-carb approach studies as listed here. Lifestyle therapy for stratification for diabetes. Complications includes nutrition, physical activity, sleep, behavioral support, and the subtopics. Assessment of nutrition status can be done through multiple ways. Here is the 4-Leaf Survey 2019, which is a 2-minute dietary assessment tool for estimating the percent of your calories that are derived from whole plants. 4-Leaf was designed to help you leverage the simple concept of maximizing the portion of calories that come from whole, plant-based foods. Your answers to these 12 questions enable us to estimate your overall pattern of eating, and will also make it clear what steps you might wish to take to improve your score and your overall health. Billing codes for nutrition analysis can be seen in detail here. Role of exercise is immense, with goal of 150 minutes WK of moderate intensity or 75 min WK of vigorous intensity. Greater benefits with 300 minutes week of moderate or 150 min WK of vigorous activity, muscle strength today week. When writing a prescription for exercise, we must mention about frequency, intensity, time, and type, specific and measurable. For example, frequency, exercise 3-5 days per week. Intensity, train at 60% of maximum heart rate. Timing, 30-60 minutes daily. Type, aerobic, treadmill, cycle, power walking with weights, strength, light weights or yoga, resistance bands, stretching, yoga, tai chi, floor stretching, combination, 7-minute workout by night times. Other specific programs. The role of fingers. There is no surprise that 480,000 die from smoking-related illness yearly and 80,000 die from alcohol yearly. Moreover, $300 billion are the annual costs. Medical costs plus lost productivity. 40+ cancers are related to tobacco use, 1/3 of cancer death. Others than diseases as diabetes, rheumatoid arthritis, stroke, heart disease, COPD, impaired immunity, reproductive problems in men and women, poor wound healing, HPV-related disease, AMRD, fracture, muscle pain, company addiction. So, if you really want to be rich, you know where to save the money from. Let me share a big secret trick which is called 5 A's for smoking cessation. Ask. Identify tobacco use document. EVERY time. Advise. Strong, clear, personalized advice to quit. Assess. Is the user ready, willing to quit? Assist. Counseling, pharmacotherapy, arrange. Follow up, accountability. Within 1 WK before quit date. 3 after. Alcohol. 17 million adults have some form of alcohol disorder. 26% of American adults are at-risk drinkers or have mild alcohol disorder. I would advise anyone to explore Audit C to determine alcohol use disorder identification test. Often sleep is seen as inconvenient wasted time. We are encouraged for extra work during late night or early hours. 20% of Americans sleep. Short sleep is associated with cognitive impairment, stroke, heart attack, accidents, injury, and even cancer. Stress. 70% of primary care visits are related to stress and lifestyle. Stress make it less likely to engage in healthy habits. Healthy habits can improve mood. There's a nice and easy to use perceived stress scale with just 10-question assessment to identify those who need closer follow-up. For each question, choose from the following alternatives. 0, never. 1, almost never. 2, sometimes. 3, fairly often. 4, very often. Feel free to pause the screen and calculate. Let's do this. Plenty of research has shown that mental health is related to outcomes. It is an independent risk factor for multiple health problems as coronary events, double with depression, endothelial dysfunction, lower heart rate variability, increased platelet adherence, worse lifestyle choices. Diabetes is a risk factor for depression. We need to ask if over the last 2 weeks, have you felt down, depressed, or hopeless? Little interest or pleasure in doing things? Non-pharmacologic stress management. Mindfulness can be practiced in daily life in many ways. Be like an observer of yourself. Being present in the current moment. Self-awareness. Self-regulation. Non-judgment. 10-minute mindfulness practice daily. Mindfulness-based stress reduction. Group classes or online sessions are usually 8 weeks. 9 sessions course available through Heartbeats Academy, UK. Please feel free to message us to explore such course if needed, even on a personal basis. Zen. Mindfulness of the ordinary and everyday. Example, Ana's turning on the water. Water flows from high in the mountains. Water runs deep in the earth. Miraculously, water comes to us and sustains all life. Example 2 is washing your hands. Water flows over these hands. May I use them skillfully to heal those who are suffering and preserve our precious planet. The next pillar is love, which comprises of compassion, that is to maintain attitude of kindness, friendliness, gentleness towards self and others. Loving, caring relationships are essential in healing, both interpersonal and group alone. We go faster, together. We go farther. Showing compassion to others helps yourself and better outcomes for patients. Healing presence, attitude of gratitude. One should have a coaching mindset to enter this field. It helps to have had experience as an expert, coaching authority, partner educator, change facilitator who defines agenda, elicits client agenda, define possibilities together, solves problems, focus on what's wrong, focus on what's right, have all answers, discover answers together, wrestle with client but also dance with client, focus on own agenda, and also learns from client's story. Billing codes for nutrition analysis are following. Success story: a plant-based diet helped me lose 100 pounds and saved my life. Erica Gray lost more than 100 pounds and reversed type 2 diabetes after transitioning to a low-fat, plant-based diet. Within a year, Eric lost 103 pounds, lowered his cholesterol by 160 points, restored his blood pressure and glucose levels, and went off all medications, which cost him close to $1,000 each month. He now enjoys creating healthful recipes with his family and competes in local road races with competitors half his age. Our daughter's wedding was 6 months after starting a plant-based diet. There is no way Jim would have been able to dance all night if he did not switch to specialized lifestyle medicine diet and process. Summary: the burden of chronic disease is staggering worldwide, with heart disease, cancer, and stroke taking 1,500,000 lives in the USA alone. Lifestyle medicine, as a brand new specialty, seeks to treat the cause of chronic disease just like traditional medicine has its tools and equipment. Lifestyle medicine has special modalities and disciplines. You have unique opportunity to be qualified to participate in this brand new specialty and become leaders in the field. Lifestyle medicine offers board certification on par with other professionals. Future directions include plenteous team-based primary and specialty care, value-based payments, payment for a diagnosis and episodes of care instead of visits. Whole health program may offer unique career opportunities. The course takers who certify in lifestyle coaching and/or nutrition and cooking classes may be able to have independent sources of income.